Hello, Neil O'Neill for Pursuit Physical Therapy. I just wanted to cover 4-way hip exercises, and obviously that's going to be flexion, extension, adduction, and abduction. But I say 4-way, but I'm only going to really show you 3. You're going to see the 4th in the standing hip. That's the abduction. So I never add abduction to an exercise routine because you end up overworking the abductors. As you'll see, as I go through these, right, and do all these exercises, the abductors on this side do all the work, do a ton of work. So you don't then want to also do an abduction on the opposite side, on the standings, or on the movement side with the band that you're using, because it overuses the hip abductor, and then you'll get a really sore hip and stiff hip, and it'll actually cause more pain than it's treating. Okay, so really the 3-way hip exercise. Now I'm just using a elastic cord or elastic band. I highly recommend actually getting an ankle brace and using a fixed weight, because in that way the amount of weight that you're lifting is very linear. The problem with bands is that they are logarithmic and they become very difficult to move, and so can be very dangerous and not as helpful. However, I'm going to show it on the elastic band because sometimes that's all you have. Okay, so the first exercise is hip flexion, and so I of course have the band around my ankle. Now I'm not going to use anything, and I am going to show you arm movements, and ideally you would initially hold on to something, get your, learn the balance, get the strength, get the form down, and then move to doing it with your arms. So I'll just show you the beginning. So you're going to start just like you're going to run. You're going to pull your leg up in resistance to that band. The second is adduction. So again, you're going to pull your legs together. You can see I'm adducting, I'm bringing my legs together. And then the third is turning and pushing your leg away. Now I'm holding the wall, but really it would look like this. Okay? So those are the movements I really want you to do with those exercises. That really strengthens up the hip, challenges the balance and the integration of the pelvis, the lumbar spine, the thoracic spine, the arms, and the leg. So you're not just doing a hip strengthening exercise, you're doing a full body neuromuscular re-education.